So let's take a look at why pressure is going to change whenever we start having branching within the arteries. It's more than just the change of radius we have to worry about with pressure differences. We also have to worry about the volume of fluids within the vessels themselves. So what to remember is that we have a pressure that's based off of the dynamics of the fluid in the tube, where we're going to have that parabolic motion within the lumen based off of the coefficient of friction between the fluid and the lumen itself, leading to the fluid within the center moving faster than the fluid surrounding it. What to remember is that the greater volume we have within the lumen, the greater positive pressure the lumen must exert, meaning that we're going to end up having a greater amount of pressure within large lumens where we can have large amounts of volume. What we have to remember is that as branching occurs, the total possible volume of fluid within the lumen is going to decrease. At the same time as branching occurs, the total possible length of lumen increases. This is going to change the equation of pressure within the lumen as we now have longer lengths, which means that the numerator of the change of pressure equation now becomes larger. So if we look at the volume based off of the size of the diameter, in the large elastic arteries we have a very large volume of fluid. This large volume of fluid is going to allow us to have large amounts of pressure within the individual lumen, within the individual artery. This continues through the first few branches, where we have few branching, meaning that we have a larger total volume within the lumen, allowing for a larger amount of pressure due to elastic return. However, as we continue to have branching, we have smaller and smaller volumes within the individual lumens, which means we have less pressure pushing back on the lumen itself from the fluids. This is why when we look at peripheral pressure readings, we end up having more pressure, say, in the left upper extremity than in the right upper extremity, because by the time we take the measurements, we have fewer branching points on the left side than on the right side. Additionally, when we start getting into these smaller diameter arteries, we start having more muscle within the lumen to propel the fluid forward, because the fluid is going to be less than what we have within the elastic artery. This diminishing pressure is continuous with the volume of fluid through the single lumen, meaning that as we have more branching within the lumen itself, we start having diminished amount of pressure from the fluid pushing back onto the lumen itself, which allows for a slower rate of flow within smaller diameter vessels. This slower rate of flow is important when we start looking at capillary functions and the ability to have movement of materials from the capillaries into the tissues via diffusion, as the rate of diffusion will be impacted by the volume and the velocity of flow, something that we're going to look at when we look at how the kidneys function at the nephrons in particular.